Hi everybody, my name is Eva. I'm a 37-year-old from California, and I'm making this YouTube video and a series of videos because I'm getting SGAP flap breast reconstruction tomorrow after many years of other reconstructions that just didn't seem to work out for me. So I'm going to explain a few things. I guess I should start with my story. When I was 33 years old, I had tumors that really hurt my breasts, and I was really fibrous anyways. I've had problems with the pain for quite a long time. Couldn't touch them, couldn't lay on my stomach. Anyways, I started getting pain that radiated up under my left armpit, and then they saw a suspicious mass, and I would have had to keep on checking it. I decided to go ahead with a prophylactic double mastectomy with immediate reconstruction, and I did so using expanders and then eventually got implants. And so I guess I should start there. I had the bilateral mastectomy with the expanders, everything was going great. I expanded to 700 cc's. For the exchange surgery, he put in 800 cc naturals, and it made me a 38 triple D, which was way too big for my frame. And people ask me all the time, well, did you want that? Well, I wanted boobs, but nothing quite so crazy. But besides feeling overstretched, and I figured over time that would have felt better if I would have just left it alone, I had a lot of neurological symptoms that were really strange, and I'm allergic to a lot of things, so I thought maybe something just didn't seem right and it didn't feel right. So I ended up getting a deconstruction, waited a year, and I was surprised. I was like, okay, I guess I'm going to try it again, but I'll go smaller, different shape, and see if I feel better. So I got the expanders put in again, expanded over a period of time, which was quite a bit, and then I ended up getting, like, I think it was 510 cc Sientra teardrop shape. They looked really good. But again, really cold, really hard, and maybe they would have gotten softer over time, but extremely painful. Um, Very, very painful. And I was having the neurological signs kept coming up. I was getting neuralgia in my face, I was getting numbness in my arms, a lot of weird stuff. So, a lot of plastic surgeons are going to tell me that there's no association, but I just felt for me that I was probably allergic to the silicone. It was just better for me to deconstruct. So I deconstructed again and just pretty much assumed I would never have breasts again. I was actually planning, surprisingly, for another tattoo. And I was just thinking, I'll just tattoo something beautiful on there and it'll be done. But I went to see my surgical oncologist because there's some parts on my chest that I didn't like, which I will be showing you my chest. And she was telling me that she had somebody that was from UCLA that was excellent, and that's what he does. That's what he specializes in, is flap surgeries for breast reconstruction. So I went upstairs just thinking I was going to get an appointment and make an appointment, and he ended up seeing me. Spent a lot of time with me, over an hour. Um, Great guy, explained his background, his education, um, what he knows about um, all his knowledge for flap reconstruction. And so, um, okay, so the procedure is called an SGAP, SGAP flap. So SGAP stands for superior gluteal artery perforator. So you've probably heard of IGAP too, and that's interior. That's so superior is higher up on the buttocks, and inferior or interior is on the crease of the bottom of the buttocks. So I have enough junk in my trunk, I guess. So I wanted to be a C, and we scheduled the surgery. So it's pretty fast. It's like 2 weeks. So surgery's tomorrow, and I've had these 2 weeks to really like research and stuff. And I was on YouTube trying to find other people to explain, give me their experiences and stuff, and really couldn't find much. So I'm really not doing this for myself. I want to do this for other people like me who is trying to find somebody's story. So I have something to grasp onto. And so I thought, what better way than like to record my journey all the way through, so you all can, see if this is something you would want to do or not, and hopefully there is no complications. But so a few facts. So SGAP is usually only reserved for people who, one, don't have enough tissue or fat on their abdomen to do like a deep. Most people do a deep flap, and that's using their abdomen, which people love because they get like tummy tucks, which is awesome. But I had a total hysterectomy, oophorectomy, when I was 22 years old. So it damages your blood vessels. So it's not gonna work. It's not good. So um, we mapped out he used a Doppler, which doesn't hurt, by the way. It's like an ultrasound, and he listened for my veins, which makes like a really cool, almost sounds like when you're pregnant and you're listening for the baby's heart. Anyway, so he maps out your veins and the branches, as he would say, the leaves, and sees if you have good branches. And so what happens is when he takes that skin and that fat surrounding that skin, then he closes that up, and then the veins, he connects with the veins in your chest, so it's like alive. And from some of the people I could get some information, they said it was wonderful because your breast is warm and it's alive, and it's squishy, and so that's pretty awesome. Now, that's not to say that complications can't happen. I mean, you have a chance of necrosis, you have a chance of it not getting enough oxygen, you have a lot of chances. It's a really big surgery. So they say 4 to 6 hours per breast, but he's telling me that it's probably 6 to 8 hours. So we decided to just do one breast at a time. Now I'm marked for my right side, but my paperwork says the left. So tomorrow I don't know if he's going to do the left or the right. I don't know if it's a big deal with the paperwork or whatever. So it doesn't matter. I do one side, and then in 2 to 3 weeks, as long as everything is doing good and I feel good, then I could do the other one. And for you to know, there is a chance of revision surgeries. Maybe if you're just doing one, to lift the other side so it matches. But I have a double, so and also nipple reconstruction, but that's also later as well. That's later down the line after both breasts are done. So maybe for Christmas I'll get nipples, or before. That'd be great. So I have factor V Leidens, which is a blood clotting disorder. I have a history of a pulmonary embolism, but I was on heavy doses of Premarin at the time. So it's a very risky procedure. He told me that it'll be about 6 to 8 hours, and I will be in ICU for a day or two. And he's going to have a little electrical unit on my flap, and if the oxygen levels drop, then his phone will be alerted, and I'll immediately go back to surgery. So here's another fact. He told me 90% of complications happen within the first 24 hours, and 95% happen within the first 48 hours. So once I get to Sunday, as he would say, I'm out of the woods, 95% out of the woods, which is really good. So it's just getting through the surgery and getting through the first 48 hours. So when you think of that, it's pretty positive. If you have to go back to surgery, okay, so here's another fact too. If you would have done both breasts, once you pass 8 hours, you have your chances of needing a blood transfusion goes from like 1 to 20%. So that's also why I have no problem just waiting and doing one breast at a time. And if God forbid, I have any complications, I go back to surgery, I do have a high risk of needing a blood transfusion. So we just pray that it's all going to work out wonderful and it's all going to be amazing. So this is my journey, and I guess the journey starts tomorrow morning, and it's already been started for a while because of all the mastectomy and the reconstructions, but I'm hoping to help any of you ladies out there, or any family of ladies that need support and need someone to talk to, that I'm here for you. And you could follow me, and hopefully I can. My mission is to support and encourage and just be there for you while you go through this, while I go through it, and yeah. So if you have any questions, I try to write things down as much as I can, but I'm pretty nervous for tomorrow, and I'm always nervous no matter how many surgeries I've had. But as the video blogs go on, I really want to encourage health and fitness, because I try to be as healthy and as health conscious as I can, because I think a lot of the things that are happening to our bodies now is because of all the yucky stuff in our food and in our environment and stuff. And I don't want to sound all crazy, but I'm just saying, I like to be informed and open-minded to all that stuff. So I'm going to show you my chest. I almost forgot the interesting part. So if you have any children or kids that you don't want them to see this, then please turn off the video. If this is going to bother you, please turn off this video, and thank you for watching. And if you're going to keep watching, this isn't sexual or pornographic in any nature. This is meant strictly for education and support purposes. Again, nothing negative or bad, and please don't comment anything that is negative. Come from a place of love and support. I mean, this was pretty traumatic for me, and I'm sure as for a lot of you as well. I also do have a GoFundMe account. It's gofundme.com/Eva B Reconstruction. I'm trying to get help. If you can, anything would help for my medical bills and for food and such. So, anyways, okay, my chest. The great unveiling. Okay, so this is my chest. I'm going to turn to the side so you can see. Let me put this down a little bit here. I'm pretty concave. I do have a keloid on that one side. So, there. Now you can see how concave I really am. So I'm interested to see how they fill that in, and let's see, here we go. So what I didn't like is, you can't even really tell with this lighting. It's actually nice lighting, makes it look a lot better than it is. I have this hanging thing right here, and it was just really uncomfortable, and you could really notice it. And I have it on the other side as well. So that's the areas that that really bothered me that I showed, and the markings on my glutes, which I will try to get up here. So this is the marking. And I don't know if you can see. Oh, I could hardly even tell anymore. He had a bunch of X's inside, but that's where it's going to be. So he's going to cut this out, and then this is going to be sewn together. It will create a divot for sure, but both sides will have it. We had to go a little mid glute because I do have a tattoo on my left side that kind of goes down. Otherwise, it would have been it would have been a little bit higher. So I guess that's it. You've seen everything that hopefully will be like a good starting point for you to see where I began. And if you have any questions, feel free to ask, or yeah, I'm here for you. Thanks.